Hi, everyone. Welcome tonight to our education webinar series. Tonight is focused on diet and nutrition, which we know is incredibly important to all of us, no matter where we are in our journey. So tonight's webinar is Digesting the Facts, Nutrition Guidance for Stomach Cancer. And we are lucky enough to have Fiona Amos, who is a registered dietitian at the Mount Sinai Hospital Cancer Clinic. And she specializes in evidence-based medical nutrition therapy for individuals living with stomach cancer from diagnosis through survivorship. She works closely both with medical and surgical oncologists to develop personalized nutrition plans that help manage treatment side effects, to improve nutritional status, and to support preparation for surgery and promote recovery afterwards. Before we start the presentation, just a couple of, housekeeping notes. Everybody, I think, is muted. You can put any questions you have into the chat. We will have a Q&A after Fiona completes her presentation. If there's something really urgent that you want to ask during the presentation, please just feel free and we'll determine if we can interrupt. If not, there'll be quite an extensive time for Q&As, and it will. Yes, indeed, we've already had a question. This is going to be recorded. It will most likely go up on our YouTube channel within the next day or so. It will be available. So with no further ado, I would like to introduce Fiona Amos.
Hi, Teresa. Thank you so much for the introduction. I'm Fiona. I'll be going over our Digesting the Facts Nutrition Guidance for Stomach Cancer this evening. Thank you very much for everyone for joining me and taking time out to learn a little bit more about the role of nutrition. So for today, I thought we'd really go through the whole journey together, starting from diagnosis, going through all the treatment navigation, and all the way up to preparing and recovering from surgery, because I'm sure, as all of you know, many treatment plans also include a surgical component. So the first part I wanted to talk on is the nutrition after your diagnosis. This is one of the most common times I get a referral immediately after someone is diagnosed, and you might have so many questions right away. About your diagnosis and what you should change or do to your diet. So it's important to recognize that nutrition has such an important role in your treatment. We know that nutrition can help heal and recover faster from treatment, reduce your risk of developing infections, support your immune system. It's also really important just to keep up your strength and energy as you go through treatment. And we also know that for those who will be getting surgery, nutrition status is shown to improve surgery outcomes and healing, and also provide all of the vitamins and minerals our body needs. One of the biggest questions I get asked when someone's first diagnosed is, what should I eat? And I think it's important to remember that there's no single food, that can treat the cancer or improve your immune system. And instead, I like to have patients look at their overall dietary pattern. And what that means is we want to be looking at what our plate looks like on a daily basis and making sure it's balanced. And the balanced plate that we recommend during treatment is also very similar to what you might recommend as healthy eating to prevent other types of chronic diseases and to support our body. So there's no special diet. It really just is a whole foods diet, focusing lots of fruits and vegetables, about half of your plate, whole grains as a quarter of your plate, and then another quarter of your plate as protein food. And that can include meat and fish, as well as plant-based proteins. like lentils or beans. I also wanted to put an emphasis on including healthy fats like olive oil and avocado, and making sure you're staying really well hydrated. Fluid needs are very individual, but a very general guide is, the 8 cups a day that you might often hear. One thing to keep in mind is that protein requirements are higher than normal during treatment. For this reason, I often tell people that you should include, protein source at all your meals and as snacks during the day. In terms of protein sources, we really want to make sure that you're getting it from a variety of options, whether that be meat or fish, nuts, eggs, dairy products, or if you prefer plant proteins, beans, legumes, things like that. And I also wanted to highlight as well here some protein powder or drink options like protein drinks or shakes, which can be helpful ways to meet your protein intake if you have symptoms during treatment that make it hard to eat your regular food. Another common question I get related to this is, should I eat plant-based proteins? So we do know that plant proteins are actually really important for cancer prevention and to reduce the risk of reoccurrence. And plant-based proteins, as I mentioned earlier, things like beans, tofu, nuts and seeds. But I also think it's important to recognize that you can still get the benefits of a plant-based diet without necessarily having to cut out food groups like animal proteins, like dairy or meat. It's more so just about choosing plant protein more often. Um, Even the American Institute of Cancer Research, their cancer prevention guidelines actually still recommend that you can even have red meat, about 12 to 18 ounces per week within their guidelines. So it's not something that we recommend people have to cut out. And we also want to recognize that when you're going through treatment, sometimes the, standard guidelines vary even more. Obviously plant proteins are really great, but you do have to eat, a larger volume or portion in order to get an equivalent amount that you would from an animal protein. This can be really challenging if you have symptoms during treatment, you've just had a surgery, which can make it hard to eat large portions or some of those fiber foods. And I always tell people that it's much more important to nourish your body and make sure you're meeting your protein needs than adhere to like a fully plant-based diet or even have any plant-based foods because there might be periods where you're not able to tolerate it, and that's okay. Um, it's, a short-term diet that you're going to be on for a very unique period in your treatment. And so we want to make sure we're prioritizing your nutritional status. I also quickly want to touch on food safety, which is another common question I get asked. Certainly, if you're on certain treatments that can make you more at risk to develop like a foodborne illness. So I just wanted to quickly have a QR code that will link you to the Canadian Cancer Society's Food Safety Guide. That's something you can check out after the presentation on just ways to make sure you're eating safely through treatment. Another topic I really wanted to touch on is another question I get asked almost every day in clinic, which is, are there foods I should avoid? So these are kind of the main categories that we recommend limiting. And I say limiting because I truly believe that there's, an all foods fit approach. And there are some foods, even bad foods, that can be, or bad in quotes, that can be enjoyed in moderation. So foods we do recommend limiting or avoiding are alcohol, um, processed meats like bacon, ham, deli meats. We also do, as I mentioned, we recommend limiting red meat to 12 to 18 ounces per week. A lot of like junk food like potato chips, cookies, really sugary beverages like milkshakes or soda. And I also wanted to highlight salt because we do know that for some types of stomach cancer, very high salt intake has been linked to the development. And we also know that moderate salt intake is also good for a variety of other chronic diseases like heart disease, blood pressure management. So it's something that we'd recommend limiting as well. Next, I wanted to get a little bit into sugar, which is another common question I get asked once, like almost always every day in clinic, about whether or not you can have sugar, it's safe to eat. And before we get into that, I think it's really important that we define what sugar is. So in this case, we want to make sure we're distinguishing between the two types, which is two types of carbohydrates. And all carbohydrates will get broken down into sugar in our bodies. But there are two types. One is complex carbs that you might see in starchy vegetables and like rice or bread or pasta. And then there's other more like simple carbohydrates, which just means your body is able to digest it faster. And that's things like juice or things you might think of like as sugary treats and desserts. So this kind of leads me into the next question, which is, does sugar feed cancer? And now that we have kind of an idea of what sugar is, we know that it is in complex carbohydrates and simple form. We can get a little bit more into whether or not it's safe to have. Um, so it's really important to understand a little bit about our metabolism to help better answer that. So in simple forms, all of the cells in our body do need sugar or glucose as energy. So they all use it, including, your own body cells as well as cancer cells. But it's also important to recognize that cancer cells also are able to get energy from other sources. So they are able to get energy from your muscle. They're actually able to break down your muscle and convert it into sugar from the amino acids. They're also very adaptive. They can even get sugar from other dead cancer cells. So what would you do if you cut out sugar? So the issue with this idea is that you would think if you cut out sugar, you would be able to starve the cancer cells. But unfortunately, as we mentioned, the cancer has a few other sources of energy. So even if you were to stop eating sugar, you would not be able to necessarily cut off its energy source because it's able to get energy from other options. And so in general, we do not recommend eliminating sugar because it does not directly feed the cancer. However, there is a little bit more nuance. So as I mentioned, there's those two types of sugar. And we know that eating a lot of very simple sugar, the concern more so is that it can cause like high blood sugar and maybe lead to weight gain. And we know that obesity can be an increased cancer risk, but it's not the actual carbohydrates themselves that's a concern. It's more so if you're eating it in excess. And we do know that complex carbohydrates, they don't tend to lead to those big sugar spikes as much. And we also know that they have lots of like nutrients, and they're part of a healthy balanced diet. It's more so like excess simple carbohydrates and desserts, which maybe have more calories that you would want to be limiting, but they can still be part of your diet in moderation. And then I also wanted to touch on the protocols that we do in our clinic for the management of micronutrients. So in our clinic, all of our patients undergo an iron panel, and this is because iron deficiency is very common in this population, and it's partly due to the changes in how we absorb iron with stomach cancer. So there could be underlying inflammation, which affects our metabolism. And there can also be, loss of blood from the tumor, which can lead to bleeding and iron deficiency. And so for that reason, we often test. And if we do find that you're low in iron, we typically give IV iron instead of having people take like an oral medication. And the idea behind that is you're like bypassing the altered absorption sites so that the iron is going to be able to be used effectively. And then the other vitamin I also wanted to mention is vitamin D. In general, most Canadians, we don't have a lot of sun. It's hard to get through food. So most people do benefit from being on like vitamin D, and typically around 1,000, 2,000 IUs or international units is what we'd recommend on a daily basis. And that's something we kind of standardly recommend as well, unless you have a risk of being like deficient, and then we might do a blood test. So this is all really, we've kind of talked about what to do for nutrition. And, if we could all just do that, the presentation would be over. But we know that, it's not that simple. Treatment as well as the underlying cancer itself comes with a whole host of side effects that make it really hard to eat and follow these recommendations. So I wanted to go over a few really common ones that we find people experience and kind of just briefly go over how we can help manage them. And before we go into these, I did want to have a quick disclaimer. First of all, it's really important that you bring up any symptoms you're experiencing to your team. Certainly, many of them can be managed through diet, but oftentimes, diet alone may not be enough to overcome some of these symptoms, and sometimes medication does play a role. So it's really important you speak to your care team to make sure that you're optimizing your management. And the other disclaimer I wanted to include is that I will be mentioning some products that I recommend to my patients. And I just want to have a disclosure that I don't have any like relationship to the like products or the companies, and it's just things that we recommend because we think it's helpful. So the first symptom I wanted to talk about was mouth sores, which you could develop as a result of like different chemo or treatments. Typically, we recommend just brushing your teeth a lot, maintaining good mouth hygiene. We'll often recommend people have more liquid foods or sometimes colder, very bland foods. People can be, the sores can be irritated by like very spicy or acidic foods, and it's easier to take down liquids. So you can also moisten solid foods with broth or gravy or a sauce or puree them to make it easier. And sometimes I also tell patients to try and use a straw if you can to bypass any sores in your mouth. For nausea and vomiting, we typically recommend just trying to have, small portions. We do find that it can be a lot on your stomach to have a big meal, but at the same time, skipping meals entirely can even make your nausea worse. And then we also recommend that if you are having quite a few episodes of nausea or vomiting, sorry, you may lose fluid. So it's really important that you're rehydrating, and you're also replacing electrolytes that might be lost in the fluid. So at our clinic, we typically recommend that if patients are having like severe vomiting after treatment, they're hydrating with Pedialyte or another type of product that has electrolytes. Um, and then we do recommend having just dry, bland foods. And another product I wanted to highlight is like a protein drink, and it's kind of like apple juice. And I've personally found that patients are able to tolerate this type of protein drink a little better than some of the others, especially when they're very nauseous. And that can be a good way to make sure you're still getting enough protein in on, days where you're very symptomatic. Um, Diarrhea during treatment is another common symptom. Similarly, if you're having, quite severe diarrhea, multiple episodes per day, you're also going to want to make sure you're rehydrating with an electrolyte drink. Um, we often recommend having foods that have soluble fiber. These help firm up your stool a little bit, which includes things like bananas or applesauce or oatmeal. We recommend avoiding artificial sugar, especially sugar alcohols. One easy way to know if it's a sugar alcohol if it ends in OL on the list. So like sorbitol, mannitol, those can sometimes worsen diarrhea. Avoiding really greasy or fried foods. Um, and then the other type of fiber, which is insoluble fiber, that's something you'll find more in like beans. Think of like things that maybe are very gas producing, like beans or broccoli or lentils. Those can sometimes make it a little bit worse. And I also have had some people, if they have diarrhea as like a side effect during treatment, you can also use a soluble fiber supplement like Metamucil, and that can help to mitigate the diarrhea. Um, Another really common side effect is taste changes. So people may notice that, as they're going through treatment, food just doesn't taste the same. May taste metallic, bitter, generally off. Maybe foods lose their flavor. And there's different cooking techniques you can do depending on the type of taste changes that you're experiencing. But some common recommendations we have are using a baking soda and salt mouth rinse, like gurgling it and swishing it in your mouth before meals. It helps keep your mouth a little bit more moist. We find that if you have dry mouth, it can worsen the taste changes. Um, Another thing that we also recommend is sour lemon candies. Again, it like stimulates saliva and helps kind of like prep you for a meal. And then these are some commercial products I also wanted to highlight. So Metaquil is another mouth rinse that's designed for patients undergoing chemo who have taste changes that you can rinse out before meals. A sugarless gum that we recommend, and a lot of our patients, their dentists will recommend this if they have taste changes. It's a sugarless gum that can just help um, keep your mouth a little bit more moist and help kind of cleanse it before eating. And then the last product I wanted to highlight is Boost Soothe. This is another product that's specifically designed for patients who have taste changes on their chemo. It's like a high protein, high calorie drink. And that could be another good option if you're just not really able to eat as much as you usually would because of the taste changes. Another really common symptom I hear about is fatigue. Can be really hard to eat. Um, so a few tips that I'll recommend are doing grocery or meal delivery services, doing meal prep when your energy is at its best, so you have stuff on hand for later. I know it sounds counterintuitive, but we also know that chemotherapy-induced fatigue can be combated with physical activity. So if you're cleared to exercise by your team, that can be a really good strategy for mitigating fatigue. And also just remembering that you can always, this is the time to ask your friends and your family for help and support if you're finding it really challenging to cook or grocery shop or really get the nourishment you need during treatment. Also wanted to touch on just general lack of appetite, regardless if you have those other symptoms you mentioned. Some people just find they just don't have a desire to eat anymore, or they may feel hungry, but as soon as they start eating, they feel full quite quickly. So if you're having these types of symptoms, we recommend having, small frequent meals every couple hours or so. It's a lot easier to spread it out rather than try and make yourself have a big portion. And you're able to kind of get a lot built up throughout the day through this strategy to get all your calories. And we do also want to make sure that you're choosing really high calorie and high protein foods when you are eating. So you're really like making every bite count. Um, Sometimes I'll tell people that liquids might be easier to consume. It's also an added benefit because you'll get hydration. So a lot of popular ones are high calorie, high protein milkshakes or smoothies or soup or those commercial supplement drinks. Um, we also recommend trying to avoid if you're gonna have like a lower calorie drink like juice or water, try to avoid having it with your meal because it can kind of fill you up and make you too full to eat the calorie foods. And so for that reason, we also might even recommend that if you are gonna have hydration, you're always picking something that has a little bit of calories too. So you're really making every but like every sip, every bite count. Some other hacks that I'll recommend is buying like an unflavored protein powder. You can mix that into different drinks, oatmeal, sauces, different soups or yogurts. It's very versatile. And then also avoiding really, really fibrous foods, again, with the insoluble fiber, like really like a lot of beans or, broccoli, cauliflower, because they can fill you up and they don't provide a ton of calories. This is just a little overview of some really common high calorie, high protein foods. I'll have another resource at the end for you to take away, but this is just some ideas of, what that looks like, whether it be putting extra olive oil on your veggies or, adding an egg into your soup. Maybe you're always putting, mayo, if you're making an egg salad, or putting extra cheese into soups or chilies. So just ideas of what you can do to kind of fortify your foods or to pick more often. And then the last point I really want to emphasize is diet liberalization. So, a lot of times patients will be concerned about having more higher fat or higher calorie products um, during this time. And we really want to emphasize that eating these foods is okay. And the benefits of you having foods a little bit higher in or fat and sugar would certainly outweigh the risks of you becoming clinically like malnourished during treatment, because we know that also has adverse treatment outcomes. And we also know that most of the concerns we have with a lot of sugar is again more related to the fact that you're over consuming it and it can lead to things like obesity. But in cases like this, it's very hard to eat too much of these types of foods when you're so symptomatic. So the consequences of you eating them is not as big of a concern during this time. And I also wanted to talk about hydration. This can be especially challenging again if you feel like your appetite isn't there. Again, we kind of want to hit that 8 cups. If you can, it can be helpful to spread it out throughout the whole day. Sometimes I'll have patients set an alarm on their phone or have family or friends remind them to drink. It can be helpful to carry a water bottle with you during the day, put it at your bedside table so you're always reminded. And also remembering that you can get hydration. It doesn't have to be just from plain water. It can be from whatever drinks you like that you can tolerate and feel like you'll be able to drink, whether that be tea, Gatorade, milk, or even other foods like soup or smoothies or milkshakes. All of those will give you some hydration. Of course, we do recommend avoiding a lot of alcohol and caffeine because those can dehydrate you. And also remembering that if you're trying to hydrate after quite a lot of diarrhea or vomiting, you really have plain water won't cut it. You'll have to pick something that has those electrolytes too. And lastly, kind of switching gears, but also a little bit of a continuation, is a brief just chat about physical activity. We do know that physical activity can improve, as I mentioned, chemo-induced fatigue, but it can also help a little bit with appetite, and also your overall mood, and it can also help keep up your muscle. So it's always something that you can talk to your doctor about to make sure it's safe, and that can be part of your treatment plan. Okay. So for the remainder of the presentation, I really wanted to focus on surgery and what you can do, kind of preparing yourself, whether you've been through surgery, it's something that is upcoming, just an overview of, what it looks like and how to deal and kind of adapt to your new normal afterwards. So really briefly, diet progression after surgery, usually done in hospital, will go from clear fluids to like full, thicker fluids like yogurts or pudding. Then there'll be a period where you'll be on low fiber for a little bit, but you're eating solids. And eventually you'll be able to go and liberalize and go back to a solid diet, regular diet as tolerated. And this is all individual based on, your surgery, what type of surgery you had, and your surgeons, and how you're tolerating. In general, it will depend on what type of surgery you've had, whether you've had a total gastrectomy, a partial gastrectomy, other types of like GI resections. But these tips can kind of be used across the board for a lot of these GI surgeries. So we typically recommend to have really small portions afterwards. And again, you want to eat often so you're still getting the volume you need over the whole course of the day. But after these surgeries, your body is just not able to tolerate the same volume in one sitting. So sometimes too, when we say frequent meals, like your meal might be like a few bites, and that's okay. The idea is that you're doing it as often as you can during the day to make it add up as much as possible. We recommend separating liquids again from meals because those can also make you fill up as well. And another thing that I really want to emphasize is eating and chewing foods really well. If you do have stomach surgery, you really want to give your GI tract as much help as possible and do as much of the work to digest your food as you can in your mouth. So we really emphasize chewing to like almost like a pureed consistency to help with digestion. And everyone multitasks so much. You might eat in front of like TV or you're talking to people, and you might not even realize how much chewing it takes to really break it down. And so that's something to kind of almost just be like a little bit more mindful of and to try and focus on. And then we also recommend avoiding like a lot of foods that cause gas right after like really carbonated drinks or like again, kind of those like insoluble fiber foods um and we also recommend that you are making every bite count. Again, it can be really hard to get enough during the day, so you want to make sure that you're always having protein at every meal to prioritize that, to make sure you're preserving your muscle mass. And some people find that they have to modify the texture of their food, whether that be just like more soft or moist, or sometimes even liquids like soups or smoothies are easier to consume. I also want to talk about tips for minimizing weight loss after surgery. I say minimize because, I mean, weight loss is very common. It's likely going to happen. And so the idea isn't necessarily to expect that your weight will stay the same, but you still want to do what you can to help minimize it as much as possible. And so, again, very similar to even just the recommendations we have post-surgery, but you're really just making sure everything has is a high calorie, high protein food. So you're really optimizing every bite. Again, strategies like mixing in protein powder, avoiding really high fiber foods that can fill you up, um, prioritizing high calorie liquids. So again, choosing like high protein milkshakes or smoothies instead of lower calorie drinks like water. I always tell patients that your stomach is like your real estate. You don't want the water to like take up that valuable real estate because it just doesn't offer you um, like the calories or protein. You always want to make sure that what's taking up that real estate is also going to give you protein and calories. And but you'll still be able to get hydration as well, especially if you're choosing some of those like high calorie liquids like the milkshakes or soups and things. In terms of symptom management after surgery, one of the most challenging and common symptoms is diarrhea. And diarrhea can be caused by a lot of different conditions. So some people might find they almost develop like a lactose intolerance after treatment. So it can be helpful to create like almost like a food journal to see if you've noticed any patterns between eating dairy products and having diarrhea. Depending on the type of surgery, you may be at risk for developing fat malabsorption, which can cause diarrhea. And in those cases, you'll notice change as well to your stool. It might the color might change. It might be very light or pale, almost like tan color. Um, there might be floating stools, a lot of cramping or gas, and those would require like digestive enzymes to help support you. And then a general guide is limiting like caffeine, alcohol, very spicy foods, or very, very high fat or high sugar foods. And also knowing that another really common cause of diarrhea is dumping syndrome. So after, procedures like total gastrectomy or partial gastrectomy, food can move just a lot faster into your small intestine. Quite literally, it dumps through, and that can cause a lot of symptoms. So there's two kind of sets of symptoms, early symptoms that happen 30 to 60 minutes after eating, things like dizziness. You might notice your heart rate beating. And then there's also late symptoms, which may occur a couple hours after eating, and you'll notice like kind of a weakness or hunger. And in t to manage the dumping syndrome, to help make it easier on your body, we recommend having, again, those really small portions, but having it often throughout the day, making sure you're chewing really well, Sometimes we'll tell people to lay down for like 30 minutes after eating because it can help slow digestion. We also find that a lot of people notice that if they eat a lot of really high sugar foods, that can make their symptoms worse. We recommend limiting those. We also recommend, again, avoiding fluid at the same time as eating because it can kind of push things through a little bit faster. And also choosing foods that have more soluble fiber, which again is that one fiber that helps kind of like gel or form stools, and protein. Both of those can help slow digestion to help minimize the dumping syndrome. Another common symptom that a lot of people might experience is low blood sugar. And this can happen after these types of surgeries as well. And it's called reactive hypoglycemia. And essentially, in this case, hypoglycemia just means low blood sugar, and reactive hypoglycemia just means that you will get low blood sugar after eating a meal or a snack. And it's kind of thought to be related to dumping syndrome, especially if you're eating like again, like a food that is really high in like simple carbohydrates, like very sugary. People tend to notice it when they eat those types of foods. And I just wanted to go over the symptoms so you can recognize if this is something that you think you might be experiencing at home. So some of the symptoms, you would notice them like, you know, a few hours after eating, but then you would also know that it's reactive hypoglycemia if you eat something and your symptoms improve. So there's quite a few symptoms, but a lot of them are kind of like shaky, lightheaded. You might feel fatigued or nauseous. There's quite a few, and so it's important just to keep an eye out to see if you're noticing this after eating. And in terms of the management, I mean, ultimately, you'd want to make sure you're confirming that you are actually having a true low blood sugar. I think it's reasonable that if you are like very symptomatic and experiencing these types of symptoms after eating, you can always talk to your doctor and let them know. There are some people who have like blood sugar meters, they might monitor and check. If they're very symptomatic, so you can always talk to your doctor to see if that's a good fit or an option for you. But essentially, to treat it, you would want to be testing your blood sugar and then repleting correcting the low blood sugar with a fast-acting sugar. I think more importantly, though, or we'd want to make sure we're trying to prevent this from happening as much as possible. And try to prevent this, we'd also want to make sure that we're always having a protein food at all of our meals, all of our snacks. We're not going too long between meals. So again, we're having those frequent meals, every 1, 2 hours. We're avoiding those really high sugar foods that we know can sometimes cause this and that are also linked to dumping syndrome. We're choosing more complex carbohydrates, which again is kind of what we talked about a little bit earlier, um, since they have more fiber, so they're digested more slowly. And then as well, avoiding alcohol and limiting high intake of caffeine. I also wanted to quickly touch on just like general tips for going out to eat after surgery. For smaller portions, I really like the idea of doing like kids menu or ordering just an appetizer. Also remembering that it's okay to just, eat part of your meal and take what you need for leftovers or split it with your friend. And then also just making sure that whether you're going out to eat or going to a family's house, a friend's house, you're just letting them be aware of, your diet, letting them know you might have to have smaller portions and asking maybe the ingredients. You have an idea of what's prepared, so everyone's on the same page. And then, you can also bring your own food, so you can still participate and eat, but know that you're eating something that you can tolerate. I also briefly wanted to touch on bowel obstruction. This was a question we had that got sent in. And I think, this can be a result of some surgeries, which essentially as a result of surgeries, you can almost have like a block that comes in your bowel. And certainly if it's completely obstructed or fully blocked, you would have to like seek like immediate medical attention, but I thought it would be helpful to know what the signs are. So if you're at home and you are experiencing things, you know to reach out. So if you're not having a bowel movement for a few days, if you feel like you're going to throw up or you do throw up, you have quite severe stomach pain or bloating, and you're not passing gas, those are all signs you should seek attention, medical attention. And this is not like a full management strategy, but just as an idea, like we do have some patients who have chronic bowel obstruction or low grade where they're dealing with this on like a more long-term basis. And usually for this management, similar, you're going to have those small frequent meals, chewing really well. But one thing that's different is a lot of people will follow a low fiber diet. And the idea is that if you're not having a lot of fiber foods, it doesn't create as much like bulk going through your GI tract, and it can, if you know if there's a partial obstruction, it's partially blocked. It's just easier for food to get through if it's not so bulky and fibrous. Some people too, if depending on their symptoms, they may have like flare-ups where they need to have like a liquid diet or even, oh, sorry, even a pureed diet, depending on the symptoms. And lastly, I wanted to also touch on very briefly vitamins and minerals that are required after surgery. So it's really dependent on the type of surgery that you have and the degree of malabsorption that's going to occur after the surgery. Think, always talk to your doctor, see if you need to monitor your nutrition labs. I think especially out in the States, a lot of guidelines, they'll kind of borrow from bariatric patients who are undergoing surgery for weight loss. And it's not the same surgery, but we actually do not have our own set of guidelines for the management of vitamins and minerals after treatment or after these types of surgeries. So there are some people who will kind of loosely borrow from the bariatric patient population to get an idea of what labs to check. And I do know some patients who will also go on like a bariatric multivitamin, especially if you've had like a total gastrectomy with really extensive reconstruction. But it's really important that you're talking to your doctor about your surgery. It's very like dependent to on the type of reconstruction you've had. And also, I really wanted to highlight that they are currently doing the Integral trial, which is a really exciting research project that's looking into the micronutrient requirements for, gastric cancer patients after surgery, because we do know that the bariatric guidelines aren't for our population. It's a different surgery. And so that is why we don't always rely on those ones. And we're trying to do our own research to have our own guidelines. And then the last thing I wanted to just do a quick, um, you know, sh shout out to the Nourish guidebook. This is such an excellent guide for patients living with stomach cancer. I wanted to include it because it's a really good home resource. It includes tons of examples of those high calorie, high protein foods, different recipes to try, different symptom management after surgery, meal planning ideas. It's a really good resource, and that's another thing you can check out too after the webinar. And that was all. Thank you so much for your time and sticking with me while we went through everything. I think we're going to go and transition into the Q&A session now.
Thank you so much, Fiona, for that really great presentation on diet and nutrition. I want to ask Denise Gabrielson to join us. She is also a registered dietitian out of Unity Health Toronto St. Michael's Hospital. Some of you who have been to some of our past conferences or, well, we haven't done I think, a nutrition webinar in a while, but Denise has been part of My Gut Feeling pretty much since the beginning. So we wanted her to join in case there's just different questions coming. And I will provide whatever personal lived experience that I possibly can, but the two real experts are Fiona and Denise in terms of specific questions. So, okay, we will. So the first question we have, or is, can you put up the QR code again for the Nourish book? So just to let everyone know, that Nourish book, before we get into it, is actually a book that was worked on with Denise and another Carmen, who is another dietitian from a hospital out west, and we at My Gut Feeling have actually were very much a part of editing it and looking at it. So we have it available both to download from our website, and if you want it in hard copy, we currently have it in French and English. So all you have to do is send us a note with your address and we can send that to you. I'm going to try and see if we might be able to also get it done in Spanish. I'm not promising, but we do have it in English and French right now. So if anybody wants it to download, just go to our website under resources and it's there. Or if you want the hard copy, just go to info@mygutfeeling.ca and provide your address and we will send you a copy. All right, let's get to some of the questions. So there's one question that actually relates to something you did speak about, Fiona, which was the hypoglycemia. And I think you did a really good, you answered it very well, but the advice that's wanted here is for those people that don't have access to a monitor, what advice would you give those patients regarding maintaining a healthy glucose level without a monitor, either by food or, I mean?
Yeah, I mean, I think trying to prevent having it with those strategies we talked about in the presentation certainly can be one strategy. I think too, if you are very symptomatic, you can try to like treat it at home if you have like if you're experiencing a lot of symptoms with like the fast acting sugar, like as at least you're treating it. If you've talked to a doctor and you think that those are like kind of confirmed symptoms. I don't know, Denise, if you have anything else to add for the management.
I think, like as Fiona said, trying to prevent it is probably the best place to start. So one of the things that happens is the reason that the reactive hypoglycemia happens, as Fiona said, is um, usually it's carbohydrate or starch that's really readily absorbed. And so it causes a very rapid spike in your blood sugar. And then your pancreas overreacts a little bit to produce way too much insulin, which then is too big of a response. And then it lowers your blood sugar. So one of the things that Fiona talked about was kind of choosing carbohydrates in general that break down less quickly. So some of those foods tend to be some of the higher fiber foods as well. And those can, if you incorporate soluble fiber, for example, that can actually slow motility. So it might slow how quickly those contents are emptying into your small bowel. So it might lead to less of a sugar spike and then less of that exaggerated insulin response. One of the other things that can help if you notice you're having this, the symptoms of late dumping, like sweating, shaking, feeling very fatigued. What you can sometimes do is try lying down for 30 minutes after a meal, just again to kind of slow how quickly things are being released into the small bowel. So again, you're trying to prevent having that exaggerated insulin response. And then I think that if you've tried some of these strategies and it's really an ongoing issue, then certainly speaking with your physician to see if there's any other options. Maybe there's some medications that might help.
Great, thank you. Okay, so another question that we have here is, and this could be a tough one. So I'm going to open it up to either one of you. How do you know what portion size is good for you? What is there? Is it, I don't know, when you basically vomit or when you get that incredible pain? But, I mean, we see that, that lovely picture of all those foods that we should be putting onto our plate. And I think the reality for a lot of us is that's not what we experience kind of short term post surgery. And I can speak for myself even long term. Like I still have major issues in terms of, I've now termed it, I have food fatigue. So how do we determine that? Or what
I feel
could
like
be
Teresa,
some,
you're the best to answer this one with your lived experience.
yeah.
A lot of
14
it,
years later, I'm not doing
yeah,
that great. So I don't know if I'm the best.
I think a lot really boils down to trial and error and experimenting with different portion sizes. And sometimes it may not be just the portion size that is going to make a difference. It could be also the composition of the food, how much fiber is in the food, how much fat is in the food. That is going to determine how you feel after a meal. And Teresa, I remember like you were not able to go back to eating like pasta. And so sometimes it isn't just portion dependent. So it really boils down to a lot of trial and error. And sometimes I think Fiona suggested a food diary for kind of looking for signs of malabsorption. But that also can sometimes help you to develop kind of a list of safe foods over time. And then you can add to that list as you discover things that work for you or um, make a list of things that don't work for you. I like to kind of focus on the things that are working for you. Um, but definitely starting small portions and chewing really well. And you could start with maybe things that are a little bit easier to digest. A lot of people have trouble with meats afterwards. And so, maybe your meals don't look exactly like that plate at the beginning. Maybe they're a little bit more carbohydrate rich and the meat is a smaller portion, or you start with meats that are more easily digested, like fish, for example, or things that are really easy to break down with your teeth.
Great, thank you. We have another question from one of the attendees, Maria, who asks, why do I find it impossible to rebuild muscle and body mass even 10 years post-surgery when I'm eating well and have exercised continuously since 3 months post-treatment? Fiona?
Yeah, it can be really challenging. I think in terms of, gaining muscle, sometimes too, like definitely a combination of physical activity, but you're saying that you've exercised quite a lot as well. And sometimes too, the protein intake can be really high, to help put yourself in like a positive protein balance to help get your body what it needs to build that muscle. So you might be at like a maintenance level and not kind of getting into that like positive balance. Sometimes too, I find that if the appetite just like isn't there to just be eating enough protein. Sometimes people will benefit from like other like supplements or more fortified foods, like whey protein powder is really excellent for muscle building, or protein shakes. And it's sometimes easier to get that than eating just like regular whole foods, because they're so protein dense. It can be a little bit hard to get that amount just from eating, especially if you're having a lot of symptoms.
Great, thanks. Denise, do you have anything to add to that?
Just that, just like Fiona said, sometimes it's hard to kind of get into that positive protein balance. And then as we age, and I'm sorry, I don't know your age, but as we age, we also have developed something called anabolic resistance. So it does take more protein in order to build muscle. There's so much great research going into prehabilitation and rehabilitation in patients who have undergone these major surgeries. So making sure that you're getting enough protein, but also the spacing of the protein is really important. So a lot of the times we focus our protein kind of at like our dinner meal, for example. But it has been shown that bioavailability and usefulness of protein is better when you spread it over the course of the day. So making sure that you're including protein at each of your meals and snacks will allow your body to better utilize that protein. And then also, I am definitely not a physical activity expert, but just
Mm.
looking at like Cancer Care Ontario guidelines, for example, for people with cancer, making sure that you're also including some resistance activities or resistance exercises along with any cardiovascular exercise that you're doing. And I will leave it at that because I am not an exercise expert.
Mhm. Oh yeah, and just to add on, I think there's like also some research too that your body can really only absorb so much protein from one meal. So I think it's individual, but it'll be around like 20 to 30 grams. So some people, if you're, pounding on the protein all at once, like again, your body can't absorb it. So I really just reiterating what Denise said about really you want to spread it out like throughout the whole day to optimize the absorption.
Great. And for snacks, what would, for the snacks, what types of high protein things? Is it like, I know nuts are good.
Mhm.
Um, are there other kind of tips that we could, I don't know, put out there? I know you did go through some, but is there, because it's always, I find it difficult. That's why I say I have food fatigue because after 14 years, it's like I'm sick of trying to, be creative with things because sometimes you're just not able to be creative. Um, and so um, I think that is probably one of the biggest issues that uh, those of us that are longtime survivors, and so, I guess 5+ years where we always feel that our biggest issue is nutrition, which is why it's always such a big discussion. And an ongoing question is, what do you do at this point? Like, and I know that the Integral Research Project is also looking at, the long-term survivorship. But really, it is, it's one of the things that, has kind of has not been looked at, I think, generally. Like everyone gets focused on, of course, the really important pre-surgery and then, that first 3 months, 6 months, a year, post-surgery. But then as you move on, and all the tests stop and all of that, um, to build that mass and maintain weight. For some of us, I'm losing weight. I'm still losing weight now. So, um, and I just feel like there's nothing I can eat that's helping. So, I guess, if there's anything, I think, does the guide go into that a little bit, Denise?
We have a lot of suggestions in there for
Yeah.
like high
Okay.
calorie, high protein options and sneaking in extra calories
Yeah.
and extra
It's
protein.
that sneak in
Often,
stuff.
yeah, the sneaking in without necessarily needing to significantly change the portion size is the big key. Like if I have a favorite, one of my favorite foods, I think is Greek yogurt. Um, Mainly because it's so high in protein. So a 3/4 cup can be around 17 grams of protein. And you can get like higher fat versions. So there's lots of options that are like 5% fat, 6% fat. Yogurt is naturally low in lactose because of the active bacterial cultures actually help to digest some of the lactose for you. So I think it's like a really easy to tolerate protein that's also really versatile because you can make like a little parfait with it. You can mix it into smoothies to make a really nice high calorie, high protein smoothie, particularly if you don't really like the commercial supplements that are out there. It's like you can make like use plain Greek yogurt to make sauces and dips for things. So it's just a really versatile, easy to digest high protein food.
Great, thank you. Um, Fiona, a question about what to eat to help with low energy, especially in the morning when coffee is not well tolerated.
No. So if I'm understanding the question correctly, it sounds like you're almost waking up but not feeling like refreshed after a night of sleep. It can be caused by a lot of different like underlying causes. It might not even necessarily be diet related. It could be like the quality of your sleep, um, or other types of like symptoms. I think, in terms of kind of ruling out any potential causes where it could be from diet, is just making sure that you're spreading your meals out evenly throughout the day. And again, you are trying to get as much protein, complex carbohydrates, fat, like as you can throughout the day, so you're eating as balanced as possible. And also doing physical activity as well, we know is really helpful for energy levels. um, Denise, I don't know if you have any other strategies you would add.
I don't know that I have a good replacement for coffee, but if you have if I don't know if you eat breakfast or not, but starting your day with some nutritional intake can kind of kickstart your energy level for the day. Um, so just making sure that you eat breakfast in the morning. Um, I don't know if this would work for you, but or what happens if you have coffee, but if you're not tolerating coffee, sometimes people find that they can tolerate and if you need lactose free, like a lactose free latte. Sometimes, for some reason, I don't know if it's related to the acidity, some people tolerate like the espresso a little bit better. Or if it's the caffeine that's maybe it's too much of a stimulant, you could play around and try half decaf with half caffeinated and see if that's better tolerated. Um, but yeah, I wish there was a easy replacement for coffee.
Yeah, I still can't give up my coffee. It's the only thing that gives me energy. Um, there's another question here. So Fiona, are there guidelines for foods which are considered cancer fighting, and what quantities of those foods which should be consumed? Sorry, of
Yeah.
those foods should be consumed.
Yeah, so I think that's kind of what we touched on a little bit at the beginning of the presentation, where we're not so much worried about individual foods, but we're more just looking at our overall dietary pattern and making sure we're having a variety of food and you're, having like a diverse diet. So you're having lots of different colors of fruits and vegetables. I wouldn't say there's any better fruit or better vegetable. It's honestly the best vegetable is the one that you like and you can tolerate and you can eat. And also making sure that you're just having, getting the protein you need to help support yourself through treatment. You're getting adequate nutrition, good hydration, but it's not so much one individual food that will help you, but more just making sure your overall diet is supporting you.
Oh, thanks. So just getting back to Denise, what you said about the coffee. So people always have this belief that espresso it has more caffeine, right? It doesn't. First of all, because the amount that you drink is usually a lot less than what you would have in a regular coffee. So I think for the person who asked about that, as Denise said, and I'm Italian, so I guess I'm an expert here. Yes, having espresso is, I tolerate that more. I actually use espresso beans in my drip, like espresso coffee, like either beans or like already ground in my drip coffee. That's what I use, and I tolerate that much more.
And
Uh,
Martha in the chat also mentioned that they can handle low acid coffee. Um,
what's low? Like, what is low acid coffee? I've never seen that.
I don't drink
Yeah,
coffee
you.
because it upsets my stomach, but I don't know if there's a low acid coffee out there, but I know that espresso is lower in acid than
Yeah, most
regular
definitely, most
coffee.
definitely. Oh, he says that. Thanks, Martha. She orders low acid coffee from Amazon.
Good to know.
Hmm.
Good to know. Uh, Another question that I have is about like micronutrients and a little bit more, if you guys could go into vitamins and what are really the vitamins that are kind of necessary, because sometimes we overcompensate, as you know, because we don't have a stomach, we kind of overcompensate, and we're, you know, always trying to find out, okay, what can I take, you know, in terms of vitamins. And I once was told that basically a multivitamin, like a regular multivitamin, a B12, and vitamin D is really going to cover it. But I wanted to ask from you, just in case there's anyone out there who's wondering, like, really, what are those essential vitamins for those of us that either have a partial gastrectomy or a total gastrectomy, that we should like always make sure we're taking.
Yeah.
Um,
Yeah, and I think when it comes to like the evidence we have for specific micronutrients, it's strongest for a few. So the first is vitamin B12. We need to digest and absorb that with intrinsic factor, which is produced in our stomach. So without your stomach, you're completely missing the intrinsic factor to help digest and absorb B12. So that's one that we're kind of keeping a closer eye on. The other one as well is iron. Similarly, like the way it's absorbed is quite impacted after these types of surgeries. So that's another really common one. As well as for bone health too, we know that calcium and vitamin D are really important for bone health, and our absorption of those can also be reduced. So I mean, most people have to supplement vitamin D anyways, regardless of if you've undergone the surgery. So that's when we probably would recommend continuing doing calcium as well. And also too, um, if you have like symptoms of fat malabsorption, you would also want to be keeping a closer eye on some of those like fat soluble vitamins like vitamin A, E, and K. Usually we don't like there's you would be symptomatic if you're going to be like if you would develop a deficiency, but you can always take like a multivitamin that contains those if you're actively having symptoms, but also making sure too that you're treating the underlying fat malabsorption to prevent the deficiencies from developing.
and so I also take magnesium bicarbonate. Is that something that is recommended from a dietary perspective or nutrition,
I
or, you know,
think if you have low magnesium, so sometimes if you have symptoms of malabsorption, like if you're having diarrhea a lot, you can have loss of magnesium. Sometimes certain chemotherapy medications can cause low magnesium. One of the things to just be conscious about with magnesium is that you don't want to exceed 350 milligrams a day from supplements. And also, a
okay.
side effect of unabsorbed magnesium is diarrhea.
Hmm.
So you want to be careful that you're not taking too much magnesium. There are some forms of magnesium that are less likely to cause diarrhea than others. So kind of just being aware, I wouldn't automatically supplement with magnesium, but if you had low levels, choosing high magnesium foods, and then if you do need a supplement, just talking with someone about which supplement to take in case you are at risk of diarrhea, based on treatment or symptoms that you're already having. And just one of the things that I wanted to mention about calcium, just some forms of calcium actually require stomach acid to be absorbed. So if you have a total gastrectomy and you are lacking in stomach acid, then you would need to choose like calcium citrate as your form of calcium because it doesn't require stomach acid to be absorbed.
Okay, great. I don't think we have any more questions unless someone wants to drop one into the Q&A. Okay, so I have one last question, and again, I'm going to harp on being a long-term survivor. And, you know, we always say, and I always say in our support groups as well, it's, you know, trial and error, you know, throughout. But at what point, like, who do we go to? Should we always have a dietitian as part of our health care team, being a survivor of gastric cancer? Should we go to our family doctor? Like, because it is really difficult. And, um, you know, for myself, and I know a lot of people who are long-term survivors, yeah, it's, as I said, it's food fatigue, but it's also, it's just like, where do we turn to?
Yeah, and I don't have a perfect answer. I think, it is trying to make sure you're coordinating with your oncologist and family doctor and even letting them be aware. Maybe they like sometimes too, you have to kind of advocate a little bit and let them know, like, I would like to have um like my micronutrients tested. It may not be something that's necessarily offered to you, but something that like we do have to kind of advocate for. And I also wanted to say too, I think, a lot of things we're working on, at least in our clinic, is also trying to develop a survivorship clinic. It's something that we've been talking a
Yay.
lot about with like our surgical oncologist and our medical oncologist because we hear from our patients like this gap almost that we're seeing. And so, it's something that, for the future, I really hope we can get like a survivorship clinic as well. Some places do have it. I believe like Princess
Like
Margaret.
like a gastric cancer survivorship.
Yeah,
Oh, I'm, well, if you need help, you know,
yeah.
I'm there.
So it's something that we really want to work on and develop and have. I know some clinics do have survivorship programs in place already, but I think it's something that's so important that we're hopefully trying to get more widespread so there is like ongoing support.
Okay. So if there's no more questions, I just wanted to say a couple of things. So thank you to Fiona. Thank you very much for presenting and answering a lot of the questions that had been put forward. Thank you, Denise, for being on the panel. As everyone knows, it's Stomach Cancer Awareness Month. And so, you know, this education webinar is part and parcel of us helping to raise awareness, helping to educate each other and talk about things that really matter to us. And just a reminder to everybody, I'm just going to plug us out there. That November 30th is Stomach Cancer Awareness Day. So wear periwinkle, light up the world. We have 110 sites. If there are any other questions that people have and they just didn't think of them during the presentation, please feel free to send them over to info@mygutfeeling.ca and we'll definitely get them answered for you as best we can. We have great people to refer to. And yes, thank you, Stephanie. She's put up something about Stomach Cancer Awareness Day, but we have our resources. And that's about it on this end. And yes, if you want the guidebook, we actually have two of them. So we have the older one that we had done, which is also a great recipe book, straight recipe book. And then we have this new one, which is more of a guidebook. So it has all types of tips. So thank you, everyone. And we will see you at our next webinar, which will probably be in the early winter. And then our stomach cancer conference is going to be April 25th this time around. So everyone, have a good evening. Eat well. For those in the US, happy Thanksgiving coming up. And we'll talk to everyone soon. So take care, everybody. Thanks.